Austin.
How's it going?
Good. I'm Maya. I'm an SPTA here at Carrington College. How you doing today?
Good, how are you?
Good. So I read your chart and it looks like you're in here for a UCL injury or an ulnar collateral ligament injury.
Mm-hmm.
You had some pain here after a baseball practice about 5 days ago and the pain won't go away, and the doctor said that you had a UCL injury.
Mm-hmm.
Okay. So I wanted to do some modalities with our treatment session today, and then also after we do some ultrasound possibly, we can go ahead and do some stretching and some exercises for you, okay?
Cool.
So I think it would be really beneficial for us to do ultrasound for you. So before we do that, I just want to kind of screen you, just see how you're feeling, and then just make sure that you're a good candidate for this, okay?
Perfect.
So first off, what's your pain level today?
Right now I'm at like 6 or 7 out of 10.
Okay, all right, good. And then the main reasons that we want to do ultrasound, is particularly for you, our goals with your treatment be to kind of decrease that inflammation, manage that pain a little bit, get that range of motion back in the elbow and the wrist region, and then also make sure that you're functional towards the end of our treatment here in the clinic to make sure that you're able to go back and do those activities you used to do.
Sounds good.
Okay, so let's go over some standards that we need to go over for ultrasound. So first off, do you have a history of cancer, any malignant tumors in the last 5 years?
I do not.
No. And then you currently are not pregnant, of course. And then have you ever had any surgery in that area that we're working on?
No, I
On the right elbow, so no metal, cement, plastic in the area?
Nope.
Good. And then, have you had any issues with central nervous system tissues? You've
No.
never had a laminectomy or anything like that?
No.
Okay, good. And then you currently don't have any cardiac devices or pacemakers implanted?
No.
In your, okay, good. And then we will not be doing any ultrasound in the reproductive area or by the eyes, so we don't have to worry about that. Good. So let's go over some precautions for ultrasound. So you have a little bit of acute inflammation in the area, so that's okay. We'll just be doing non-thermal for that reason, and we'll just have to be very careful with that. And then you don't have any issues with your bones or anything. You're not growing any
No.
apophyseal plate issues.
Nope.
Good. And then you didn't fracture your elbow or anything in that region when you had the injury, correct?
No, I didn't.
Good. And then I just have to ask, you don't have any history of silicone implants or anything, do you?
I do not.
Okay, good. So going through this, it looks like you'd be a good candidate for non-thermal ultrasound. That will kind of help get down that inflammation that we have in the area, decrease that pain. The way it does that is it increases the macrophage responsiveness to that area, so we can kind of get nutrients flowing over there, and so kind of help facilitate that tissue healing in the area.
Perfect.
And we can go ahead and get started.
Awesome. Sounds good.
Awesome.
So for today's treatment, since we're going to do non-thermal ultrasound, we have the head warming off. Our frequency is 3.3 because the UCL is fairly superficial. Our duty cycle is 20%, like we always use for non-thermal. Our treatment time is going to be 5 to 10 minutes. For this purpose, we're going to do 8, including patient education time at the very end.
So, all right, Maya, so now that we have you here and we're getting ready to do the non-thermal ultrasound, I'm going to get you set up, so are you comfortable there? Perfect. I'm going to go ahead and slide this pillow underneath your arm, and we're going to be going in this, right in this area. So can I have you, yep, palm up. Perfect. Actually, let's have you just like that. I'm going to go ahead and slide this towel underneath you. How you doing? Good there?
Yeah, all right.
Awesome. So from here, I'm going to take some ultrasound gel. I apologize, it's going to be a little chilly at first, okay?
Okay.
So we're going to go right, we're going to be going right in this area here. All right? So from here, what I'm going to do is I'm going to start by moving the ultrasound head, and then I'm slowly going to turn up the intensity. And you really shouldn't feel anything with this one, but what we're looking for, it might get a little pink in the area, but there's really not going to be a lot that you will notice. So we're also doing this here today in order to decrease pain and some swelling, as well as increase your range of motion in the area because it's a little inflamed, it's really tight. And that will ultimately get you back. And then after this treatment, we're going to do some exercises to really help facilitate some strengthening and stretching for this area.
Okay. All right, Austin. So we're going to go ahead and do some stretching now that we've done the ultrasound treatment. So the first thing I want to do is kind of see your active range of motion with wrist flexion and extension,
Okay.
just to kind of see how it is after we do the treatment.
Perfect.
So I'm going to have you do this by yourself. So the first thing I want you to do is go ahead and put your arm up on the table, just like that. Good. Sit up straight. We're going to do your extension first. So if you want to go ahead and bring your wrist up as much as you can. All right. You can go ahead and bring it down. Does that feel okay?
Yeah.
Good. Okay. And then we want to see your wrist flexion as well. So if you want to flip your hand up. Okay. Sit up straight. Good. Nice and tall. Go ahead and bring your wrist up like that. Go ahead and relax. Does that feel okay?
Yeah.
All right, so let's go ahead and do the wrist extension stretch. So I'm going to have you have that forearm out like this, and you're going to go ahead and use your other hand to push down until you feel a good stretch. Good. All right, you can go ahead and relax.
How long am I going to do this for?
You're going to do that about 3 to 5 times for
Okay.
the stretch, and then we can do 15 to 30 seconds. If the
Perfect.
30 seconds is a little bit too much, we can cut it down to 15.
Perfect.
Whatever's comfortable for you, okay?
Sounds good.
All right. And the next thing we're going to do is work on the pronation supination stretching, because that's also involved with your injury as well.
Okay.
So I'm going to have you sit up straight, have that arm out at a 90-degree angle, just like this. And I'm going to face to you. So let's go ahead and start with your pronation. So I'm going to have you go this way as much as you can. Hold that. So you get a good stretch for about 15 seconds. Good. And then we can go ahead and go back to neutral. And then let's go into the opposite motion, turning supination, so we can stretch those pronators. And go as far as you can. And hold that for about 15 seconds. If it still feels okay, let's go
Yep.
30 seconds. Okay?
All right, so now that we have finished the ultrasound treatment and everything, we're going to run these through some strengthening exercises. So what I want you to start with, we're going to start with a 2-pound weight. What I want you to do just with this hand, can you first go ahead and just do some wrist flexion? Good. How's that feel? Doing all right?
Feels okay.
Perfect. And then now let's go out in front of you like this, off the table, unsupported, and can you go into some extension? Any pain there or anything like that?
No.
Perfect. So I'm going to give you this 2-pound weight. We're going to hold it just like that, and we're basically going to do a mini curl. So what I want you to do is I want you to go like this, and just nice wrist flexion, nice wrist curl, like so your knuckles are coming back up to you. Good. How's that feel? Feel like good? You can do 2 sets of 15?
Sure.
Perfect. So we'll go 2 sets of 15 there. And so for the next exercise on our home exercise program, if you don't have a weight like this, you can find something that's weighted. There's a lot of objects that you can do this with. It doesn't have to just be a dumbbell. So now I want you to go with your palm down, open like this, and we're going to do some wrist extension. So I really want you to focus on, you can put your arm here, good, nice and supported, and I want you to go ahead and really focus on bringing the top of your hand back up there. How's that feel?
Feels good.
Any pain or anything like that?
No.
Good. And so we'll also do 2 sets of 15 for this one. Good. Make sure we're controlling it on the way up and nice and slow on the way down. Perfect. So now after we did that set, you did have some pain. So on this one, I really want you to focus on not squeezing as hard just to not provoke that pain.
Okay.
How's that feel?
This is good.
Good? Perfect. So now let's go ahead and try with just 2 fingers here. So let's take your pointer finger and your middle finger and your thumb, and let's focus on those 2 right now, just grip it. How's that feel? No pain, no nothing?
No pain. I can definitely feel things working more.
Good. And so now we can actually do this one for as long as you're comfortable. We can set a time, 1 minute, 2 minutes. Anything at home that's squishy, we can really use that. Perfect. Good. So I'll take that back from you. And now we're going to work on some pronation and supination with a little bit of resistance. So what I'm going to have you do, I'm going to have your arm flat just like this on the table for me with your hand hanging off just a little bit. Good. And what I'm going to have you do, I'm going to have you grip right here. And I want you to go into some pronation very slowly. It's going to act as kind of like a counterweight, all right? So it's going to come this way. So go into some palm down, nice and slow. Good. I want it all the way even. Right there. And then let's slowly bring that back up. How's that feel?
Feels okay.
And then we're actually going to go into some supination now. So I want your palm down. Good. Awesome. So on this, we're gonna go 2 sets of 8.